There's been a lot of discussion recently around how FDA is regulating a category test or not regulating a category test called laboratory developed tests. Can you talk a little bit about what is a laboratory developed test and what is the controversy around how they're being regulated?
Right, so a laboratory developed test, think of it as something that's developed kind of in-house. So it's a laboratory test that can be developed within a single facility for a particular purpose, and these are pretty common, and I would say, for example, a hospital that develops its own vitamin D assay or something that's specific to that lab inside of that hospital is an LDT, that's what we'll call them. And the FDA has not really extended its regulatory reach into this area. However, there's another factor at play, the Clinical Lab Improvement Amendments of 1988, CLIA as it's called, which is a factor, and these are lab tests that have traditionally been kind of outside of the clinical lab improvement amendments, because CLIA has just looked at the kind of analytic validity of testing, but hasn't done necessarily a sweeping overview. And now there's a gap where consumers and others have been concerned about the, quote, true validity of these tests, and that's opened up the authority for the FDA to look at regulating these mechanisms. I would say, practically speaking, these are tests which are some of the ones that deal with the latest and kind of breakthroughs in genetics around autism spectrum disorders, cancer screening, a number of things that we see in the commonplace and that many clinicians and patients are actually utilizing, but this concern over the analytic validity as well as the reliability of the test has come into play recently, and the FDA has released a report around this, which I think is opening the door to some interesting areas.
Right, so these are tests that basically they were sold as laboratory services where a single lab would be conducting the tests, and they said that since we're a service, we're not a medical device subject to FDA regulation. Now FDA is coming in and saying, no, in fact, you're meeting all the characteristics of a medical device and we intend to regulate you. But so far the agency's been exercising enforcement discretion around a lot of these tests. And so my presumption is what the agency wants to do is certify, in most cases, the clinical validity, meaning that the test reliably says what it purports to say, but not necessarily the clinical utility. So there's a distinction there, right?
It is a distinction. And again, I mentioned CLIA because there's this interplay with what CLIA does in this case, especially with CMS and other agencies within the government. So I think at the end of the day, for what this means for patients is that it might turn out that some of the tests that we thought were kind of reliable, and these words mean something. So can you say that if you take one of these tests and it indicates that you have a certain kind of predilection for a cancer, that means something, and that's a false negative or a false positive. And I think that's where the FDA and particularly kind of the media, quite honestly, has become more involved in this for patients.
Right, and CLIA is an arm of CMS or Medicare, and what Medicare I think said recently is that they don't have the resources under CLIA to be looking at all these tests.
They don't, and that's, I think, again, what's in and outside of what the FDA should be doing has been brought to question, as well as what CMS's role in this.
Of course, one of the concerns that some people have, including myself in the past, have had is that FDA says they want to regulate to certify the clinical validity, but will they start to want to also assure the clinical utility, meaning make sure that if the test is used in a certain way, it's going to lead to an improved outcome, or should that be left to physicians? I mean, that's a big question.
And I think that this is one of those areas, much like the use of apps or mobile technologies that the FDA is going into, where I'm not sure that this was exactly what the administration had really kind of thought the FDA was charged to do. So we're seeing a very interesting time where I think, as you mentioned from your work, even in your time in the FDA recently, it's a different time for all of these areas. But consumers are out there paying out of pocket for some of these tests, and so I think it matters that we have more transparency about what at least the reliability of these tests are.